Maternity Guidelines, Your Rights and Choices. Stepping into the world of maternity care can sometimes feel like you've been handed a set of directions that reads like a choose-your-own-adventure book. Except every choice seems to come with a footnote. Hospital policies and practices in childbirth are often guided by a thick book of policies and guidelines. Think of them as the recipe book for maternity care. Except every so often you realize the chef has been improvising. Many of these guidelines come from high places, specifically the National Institute for Health and Care Excellence, NICE, and the Royal College of Obstetricians and Gynecologists. They're the gold standards, the Michelin stars of childbirth, if Michelin stars were awarded based on a combination of the best available research evidence and the collective nod of experienced practitioners. Now these guidelines are developed with the best intentions, to help clinicians serve up what is considered the creme de la creme of care. But let's sprinkle a bit of reality onto this. Not every guideline is based on robust evidence, as Prosova et al. Pointed out in 2014. Sometimes the evidence can be pretty bloody elusive. Sometimes the guidelines don't quite catch up with the latest research. Cast your mind back to 1979. Professor Archie Cochrane wasn't afraid to stir the pot by awarding obstetrics the wooden spoon for being the least evidence-based specialty. While we've made strides since then, it's still a bit of a mixed bag. The truth is, many routine interventions in maternity care may not be the one-size-fits-all solution we once thought they were. So what if the standard fare on offer doesn't tickle your fancy? What if you're concerned about the intervention suggested for your labor? You, my friend, are entitled to ask for the secret sauce, the guidelines that apply to your particular situation. Feedback, twins? A little one breech dancing their way into the world? Ask for the playbook. It's your right. Remember, guidelines are there to guide healthcare professionals. They're not the 10 Commandments. You don't have to agree with them, and neither does your care provider have to follow them to the letter. Before you make any decisions, you might dive deep into the research, consult the Oracle, Google that is, and reflect on your personal history. You might know your body like the back of your hand, recall family tales of pregnancy quirks, or trust in the accuracy of your own conception calendar more than the latest ultrasound. Beware, though, some healthcare practitioners may patronize, dismissing your insights and knowledge. They might wear their experience like a crown, but remember, it's your kingdom they're walking into. You're the ruler here. There's a dark side to this too. Sometimes when advice is declined, a healthcare provider might suggest, either subtly or as subtle as a foghorn, that you're being irresponsible. If there are complications, the whispers of "I told you so" might echo in the hallways, even if following their advice would have led down the same path. And let's address the elephant in the room, the scare tactic of the worst-case scenario. Yes, being informed of risks is important. However, using fear as a tool for compliance is not only unethical but goes against the very codes that healthcare professionals swear by. But fear not. If the maze of maternity care feels too daunting to walk alone, there's a guiding light. When Push Comes to Shove is here to accompany you with holistic maternity care that honors your voice and choices. Whether you need one-on-one support to navigate the twists and turns, or you're inspired to provide the same compassionate guidance to others, we're here to empower you. Our certification program is crafted to equip you with the knowledge and skills to support expectant mothers in their most monumental journey. This is the future of maternity care. Personalized, evidence-based, and respectful of the individual narratives of each and every mother. At When Push Comes to Shove, we're not just about supporting women through labor. We're about redefining the very essence of birth support. So join us and let's transform the path to parenthood into an empowered adventure, one birth at a time. This is the future of maternity care and education. This is When Push Comes to Shove.